Hi, again. I'm really enjoying this. Menopause. Okay. Days I would like to forget, days I couldn't forget, and days what did I do with it when it hit me. So I can just talk a little bit about, and somebody mentioned something about you're possibly going to have some surgery or you are going to have some surgery. And I did have surgery. And but I had surgery after I reached the end of my menopause. So I hit my menopause early in my age of 52, 53 years old. And what did I do for it? Um, Water and this constantly, constantly. And what else? BioTouch, as far as that was concerned. Years ago, I had just started and just asked Paul about how long this has been open and how long I've been coming in. And I was still having symptoms of the hot flashes and even cold spells. You know, you didn't know if you're moody, your cold spells, your hot flashes, or whatever. Everything is related to that. I chose not to use estrogen as the doctors prescribed. I chose not to use estrogen. I don't want to get too much into the medical field, but I do work for an oncology doctor. And I have a lot of knowledge with that. And so, with the other thing about myself personally, is that I'm high risk of breast cancer because my mother had breast cancer and died of breast cancer. She was 53 years old when she was diagnosed. She was put on estrogen, and not to get into it too much and all that, but she only lived 3 years and died at 56 years old. On my bucket list, before she had died, that thing that she told me that was on my bucket list was that I was going to come in menopause very early stage and to be prepared for it. So I was able to ask her some questions so I can understand, but I'm not my mother. I am my own person. And, I'm 70 years old now. Again, going back a little bit, I haven't used any estrogen. I chose not to. With the good help and communication with my physicians that I worked with, and seeing the history of patients coming in with their history and so on, and understanding. But one of the most important things that I have to say, what helped me was the relaxation of finding some place to come to walk into an area where you're feeling all hyper and you're not feeling good. You don't know if it's the hot flash, you don't know what's going on with you, but you know that it's a part of the menopause stages of what you go through. And then even after, like I was talking to somebody just now a little bit, even in my 70s, I just asked the other day that I was having a recurrence of like a hot flash, and she said, "Yep, you can have it the rest of your life." What do you do for it? Water, fanning, relaxation, and then I'm going to get into the fact of what BioTouch has done for me. Walking in here is just the first couple steps, and I've said this many times from head to toe, whatever is wrong with me. Walking in here is one of the most important things to me, is to communicate to the practitioner and let them know exactly what your needs are. What's hurting you? What's bothering you? You can walk in here and still be hyper and this and that, but let them work with you and understand. They may not have the cure, they're not going to have the cure, but they have the touch. And they've got the opportunity to try to help you and make you understand that they're here for you, and that's the most important thing. So when I walk out of here, as far as BioTouch is concerned, it does give me a relief. Again, I may be walking across, the street with my fan going and all that, but I have been able to connect with somebody that I feel, for I know, regardless of what it is that I'm going through in my life, but the hot flashes, menopause, choosing not to take estrogen, taking estrogen, choosing what you do for your doctors, what they say and all that. This is another opportunity for me to say what BioTouch has done for me in my life. and what it'll continue to do for my life, regardless of what my ailments are. Any questions? And you said that you are going to have surgery, or?
I haven't decided yet.
Okay.
Yeah, I'm still on the fence.
Well, years ago and today is a lot different than what it used to be. So I wish you a lot of luck. But if you've got good doctors, just get them through. Help you through it. So nothing else. Okay. Thank you for the opportunity.
Thank you, Donna. She's getting to be our regular presenter.
All right.
Ah,
Hello, everyone.
no.
Your name's Nova, is it?
Nova.
Nice to meet you. Nice to meet everyone out there in video land. This is our health condition workshop. We grateful for what Donna does. It's always nice to have a speaker who's gone through it.
Oh, yeah.
Like I can't speak about it much, but actually, I've had a lot of guys who their whole thing is what to do to help with menopause. So it helps both sides of the story here.
It's true because
Yeah.
you guys have to live with it.
Right. And then I've also always joked about the fact that guys actually are in 24/7 menopause.
Well, I won't argue with that. But there is male menopause.
Well, right.
They talk
it's
about
like
male
always, from the
menopause.
time we've been a teenager to the time we die, we're always in menopause.
Okay.
Yeah, I had a dear friend who used to say, my sons, he was an older guy, he used to say, my sons, you make women crazy. So there we go.
There you are.
So now we have a way to help instead of making women crazy. So,
Men and women.
yes.
Yes, that's what BioTouch does.
So this is our, we do a Monday show. It's called the Bev and Paul Show on Facebook. So these are called the Paul and Bev Show.
He has to have his moment, his son. Oh, yes.
So we're going to teach you the points. So since we have someone new, we're going to go right from the beginning. But also, we were talking earlier, if some of the old timers have a specific thing you'd like to know about BioTouch or something you'd like us to address more, we'd be happy to do that too. So both from the beginning standpoint and from the more advanced standpoint, even though there are no levels in this stuff.
Right.
We're all yo-yos on the boat. So we're just going to, why don't you hand those around to people? So what we've given you here is, this is a workbook of, why don't you hand us a manual there?
Oh. Me?
This is a workbook
Yep.
this is the whole manual. So this has all the sets of points, 17 sets of points that we do to address any condition in the body that the body can get. What we do in these particular workshops is we take one particular condition, so like menopause, and then we pull out the 2 or 3 important sets that we feel are the most vital to do for that condition. And then we make the little workbook. And that's what we're going to go over today. And then we'll talk more later about how you can get the whole manual, also how you'll be able to get the workbook online. So you can download it in a PDF form, and it actually has links to the video. There's actually a video that comes with the training. Yes, question?
Okay, so we know that men also go through hormone changes.
Yes.
What is that called? Menopause.
Menopause? There you go.
Because, even though a woman has lost her ovaries, men also go through changes.
Yes.
Right.
So are we going to cover any of that?
No.
No.
Because the class was about menopause, but interestingly enough, you do the same set of points.
Mm-hmm.
Because basically, as you're going to see, we're going to work on the hormonal system itself.
Okay.
And that's the same men and women. So it'll all be, as you'll see, the head, the metabolism, which works on the thyroid, the adrenals, and the lower abdomen where the sexual organs reside. So it's interesting because we pick a name of a particular condition, and then it's interesting because there's dozens of conditions that will work with the same points that you do that one condition with. So I just sent something to someone who had fallen and has brain damage now. She's actually starting to stutter, and I had to, and she actually said that she thinks she's in a little PTSD, and she's actually stuttering a little. So though we had a stroke book and we had a PTSD workbook, they're all the same sets of points. There's just different conditions, and I think what you start to see if you take these workshops is BioTouch is really quite simple.
Yeah. Well, we're area specific.
Right.
If you have anything, there's how many different respiratory lung conditions. When you do the lung set, whatever's going on, I don't care if it's emphysema, lung cancer, COPD, asthma, you're going to do the set, period. And it addresses all of those conditions, anything having to do with that, the respiratory system. So it becomes quite simple in that. Yeah.
So it's interesting, the whole idea that, I don't know if you saw the blog that Deborah wrote. I think we called it the seven dwarfs of menopause. and she wrote this thing, and so I went online, and sure enough, there's these funny cartoons about it. So I actually, if you read the blog that we did at the beginning of the month, the little photos there, the cartoon of it. So all these are the common symptoms as you read on what we've done with each workbook is also talk a little about basically what's out there on the internet and tried to bring the most important points about the condition. And as you can see, common symptoms of menopause include heart pounding or racing, hot flashes, night sweats, skin flushing, sleeping problems, decreased interest in sex, mood swings, irritability, depression, anxiety, spotting of blood in between periods, urine leakage, and vaginal dryness and painful sexual intercourse. So those are the symptoms of which this little workbook can address all those symptoms. So any questions or things you want us to specifically address with menopause tonight?
No, because I'm seeing the same thing happening to my husband. These same things are happening to my husband as well as myself.
What do you mean is happening to you? Hot flashes, night sweats?
Heart pounding, racing, hot flashes, night sweats, skin flushing, sleeping problems. All these things are basically men experiencing the same thing.
Right.
Yeah.
Also mood swings.
Yes.
Oh yeah, definitely. Yeah.
Well, I think what you're going to see is these sets of points that are in here are pretty powerful set of points. There's just 3 to teach. And
Interesting to see.
now, have you worked on your husband yet?
Yes.
Really? How was it?
It's interesting.
Interesting. Okay, that says nothing.
It works.
But he didn't notice it.
He doesn't make comments.
Right.
Oh,
That's a guy.
yeah.
We don't make comments. And it's funny when we have classes, and I'll always teach you, and it's usually women that come to the class, and oh yeah, my husband, he won't be into it. So we always say, look, you just go home, you practice on him. You don't make any guarantees. You don't tell him anything's going to happen, but you need a guinea pig to practice.
Exactly.
That's it. And then sure enough, after a couple of times, they'll go, well, don't you need to practice again?
Right.
Well, did you feel anything? Well, no, not really, but you could practice again if you want. Or there's somebody like Cheryl who's been working in this center it took 6 years of her offering her husband, and finally after 6 years, he said, well, okay, you can do it. Now it's like, okay, every
Created
night.
a monster
it's
now.
every night. And now, finally, after the 8th year, she's finally got it to where she's able to teach him now because she needs it. And she wants him to know some points because if an emergency came up, she'd want to make sure that he knew at least a couple of sets of points. And just last week he said, okay, I'm ready to learn. Just put it on the bar. When I have my night drink, I'll read a few things. We don't care how you learn it. Just learn it.
Yeah, just learn it. That's perfect.
Beer, chips.
Right.
That's cute. I like that.
Yeah, sounds good.
Maybe that'll be our Monday show.
Oh.
Beer, chips, and BioTouch.
At 10 o'clock in the morning.
Well, he does that after
5
work.
o'clock
Right.
somewhere.
Yeah, it's 5 o'clock somewhere, right?
5 o'clock. Oh, good one.
Mondays.
So, okay, well, we're going to go through the manual. Then this is the first. Now, how did you hear?
I'm new to Arizona,
Uh-huh.
and very new to Benson. We've been in Benson for about 2 months, and I've been having some medical issues that I had about 3 years ago, and thousands of dollars worth of tests, and they're just like, well, we don't know. And they just kind of shrugged and kicked me out the door. Well, they're starting up again. And I really don't know if it's perimenopause or what, so I was actually Googling, I talked to you on Monday, looking for alternative care practitioners. I haven't had very good success with the family physician that I've seen twice now, and I really don't want to go back. So I kind of started Googling everybody in Tucson for alternatives and came across you, and I'm a Reiki level 3 practitioner, and I'm getting my small animal acupressure certification right now. So when I came across you guys, I was like, oh, this is interesting. So I'm kind of wondering how it's related to those two, if at all, and again, not only to help myself hopefully find a medical practitioner that I can go see and take care of some of my issues, but also to add to my toolbox for the animals as well as people. So a whole lot of
Good.
makes a lot of sense already.
Yeah.
Okay.
Absolutely.
Well, we'll hopefully answer those questions, and if we don't, just make sure we do.
Because you can ask us questions
Right.
too.
So let's start. Bev will take us through the introduction here, page 6.
Yeah.
What it
Turn
is
to
and
the-
how we do it.
So yeah, what is BioTouch? BioTouch is a very simple, hands-on. It's one person touching another person lightly on the skin. So it is person to person. It's not, we right off the bat, I'll just say we always get this question: can you do BioTouch on yourself? And our stock answer is, well, just by definition, no. It's one person touching another person lightly on the skin in a very light, loving touch. And the power of it is it forces us to come into a relationship with another person. And so as we, as we learn it and use it, then it starts to open up what we call a self-awareness within ourselves. And everybody wins. Everybody goes on that journey, whether you're the one touching or the one being touched. So it is, as it says, so easy, even children can learn it. Now, the beautiful thing about BioTouch is, as Paul was kind of alluded to, there's no levels. As a Reiki practitioner, you understand what I'm saying. There's no levels. There's no mastery of anything. There's no initiations. There's no anything along those lines. Tonight, we will go into the session rooms and you will be able to practice with each other. You will be immediately totally effective. You will have BioTouch and you will give BioTouch, and you will all experience that power of BioTouch immediately. So there's no waiting around for it. It's instant, and it's meant for all of us. That's one of the it's a whole different thought form. BioTouch is bringing us into a whole different thought form about what healing is. It's offering us different options other than the mainstream and the traditional. So when we step into that relationship of healing, we're opening ourselves up to something that's already within us. That's one of the things. We all have the innate ability to reach out and touch another human being. That's really the only qualification you need for BioTouch. You want to help someone. That's a natural human instinct, is to just want to help someone. And so you're immediately effective. So this is for all of us. That's the one thing that's different about BioTouch. Even in the so-called alternative complementary world, there's nothing else like this. And so Paul and I are even beginning to speak a different language in terms of what is this? it's more holistic. It begins on the body, touch on the skin, and then all other different little subtle parts of us to respond as well as the body. It begins because everything's locked in our body. Everything, trauma, memory, all those experiences, things in our DNA. And when the body begins to respond, then everything else is kind of shaken up, loosened up, and begins to respond as well. We are a holistic unit with all these wonderful different parts of ourselves. And that's what healing is. It's a journey. So
and the nice thing about that in relation to how we teach this is we don't have to recommend or diagnose. So the holistic part of it is it's up to the recipient to figure it out.
right.
We just do the BioTouch, and it seems to allow the person to know what they need to do and then the courage to do it without us having to do anything. So the holistic approach is really about the individual taking responsibility for their own health care. And we just BioTouch is just a catalyst to help people feel comfortable in those decisions.
Right. Yeah, no, that's perfect. And so we don't use words like healer, healing, in terms of what happens in that relationship. We just know that they're two human beings. BioTouch breaks down all the barriers of gender, political, race, religion. It's just one human being with another human being. And in that empowerment, we each get to choose. We each get to take responsibility for what happens from there. And so it's like I think of it as a gift of us all being able to remember that it's always been there. It's not something that is now just happening to you. It's whatever is, that greatness that's within each of us is already there, always has been there. So BioTouch is just one of those things that brings us into an awareness, a remembering that we are really, the body's the healer in all of that. So as I said before, there's no levels of ability. You're automatically tonight you will already have, you'll have the juice. You'll be totally effective. And we never make any guarantees. Everybody says, well, what should I feel? I don't know. We don't make any claims to you're going to feel this and this is going to happen, because we honor your body. That's not our responsibility. We don't need to take responsibility for what's going to happen with BioTouch. It's exciting. I mean, I don't know what's going to happen. Let's just wait and see what your body wants to do with it, because it does recognize it immediately. So we don't have a philosophy. We don't have a belief system, except that we just honor everything. We honor you. We honor everything about everybody. Everybody's right. Everybody's got it. Everybody. And so for us, we don't have the need to diagnose, as Paul said. We don't have to recommend anything to anybody, because we already know that that's all already there for you. So it's totally different than, So what happens is, before we practice BioTouch with another person, we always wash our hands. And BioTouch is always going to be using the first two fingers of both hands and touching very, very lightly on the skin, like a butterfly. So I know all of you you've reached out and...
Well, let's do it, because
yeah.
Reach out and touch one another.
Yeah, Kathy, just reach over and touch each other on the skin. Yeah. It's just very light, like a butterfly. Yeah. A little sweeping going on there. And that's it. It's very, very simple. And, we just we just want to offer these workshops because you can address a specific condition, and a lot of people don't want to become a practitioner. That's not our intention. What we would like to see is this to be in every household, with members of the family doing biotouch together. That's really what we're doing here. And our extended families, in our workplaces, you can do biotouch at any time, anywhere, with anybody.
We just have one of our practitioners is actually going to do it in the local bar in Chicago area with all the dancers.
She is.
And that's going to be her. She's going to be like the house mom, and as the house mom, she's going to do biotouch along with some of the people, some of the patrons too. And she's doing that. She's been doing that for a while, and she's getting awesome results. So it really can be done anywhere. And you talked about animals, so just so you know, people have taken this technique, even though we teach it one person touching another, and they have done it with animals. So on horses and cats and dogs and chickens. We had somebody working on chicken once. So it can be done.
With wonderful results, by the way.
Because the anatomy is the same. So you're just taking the anatomy and applying it the same way. And the difference between these other techniques you're talking about is there's no pressure. So like acupuncture or acupressure, Reiki was taught with no touching, but we do touch on the skin. Therapeutic touch, healing touch, most of those times are not touching the skin either. So it's really one of the only techniques where we actually do touch, and we do touch on the skin. So it's about getting to the skin, not through the clothing. And we actually have some research that we've done. I don't know if you've all seen it, where at the University of Arizona, they actually did some testing of a research project of touching off the body, then touching through the clothes, and then doing biotouch. They did it with freshmen in psychology class. And Gary Schwartz was blown away by the results because the greatest result was touching on the skin for pain relief and feeling less stressed. And he was like, it didn't make any sense to him. So we always say touch wins, skin wins. That was it. Skin wins.
Right.
So it is very unique in the healing world that touching on the skin of one person to another and not having to center yourself or focus.
Right.
So that little page there, practicing it, that's what you do before we do a session. So we wash our hands. It's one person touching another. We begin the session with what we're going to teach, the greeting. We only use the 2 fingers. There's a couple places of the hands. And it's all done for 6 to 8 seconds. Any particular set of points that you're going to do. Okay? The terms here, we don't really go over them, but they're here because it's all the different terms that we use in the manual. We've sort of created our own little language, but as you'll see, the way we touch sort of describes the terms that are in this manual. So we don't take a lot of time to go over those in this class. We do in the there's a practitioner training where we do the whole program. It takes 10 hours. It's a weekend usually, or evenings kind of thing. So any questions about the technique itself before we just start teaching points? Deborah? No? No? You got any questions so far? Okay. So we're going to bring out our little mannequin while I get the camera ready here. And we'll just start teaching points and then we'll practice. He's back.
She lost her hair.
She always puts
Oh,
her
that's
hair
good. We don't need her here. All right.
Is this going to be
In my way, or am I guess I could stand on this side. Okay. Okay. So the very first, after we wash our hands, the very first set that we want to do every single time before we address any other parts of the body is called the greeting. And this is done, it seems to set a harmony up between the recipient and the associate. So we always want to do that. This is the only set we're going to use one hand, just one hand, and we're going to be touching and holding those points with our dominant hand. So if you're right-handed, you want to use your right hand for both points. There's 2 points in the set. And if you're left-handed, you want to use your left. So we're going to locate the first point in the set, and there's a soft tissue just below the breastbone. And we're going to take the first 2 fingers. I'm right-handed, so I'm going to use my dominant hand. And we're going to lightly put our 2 fingers and hold them right at this point 1, right in that little fleshy area just below the bottom of the breastbone or sternum. And we're going to hold 6 to 8 seconds. Every point we're going to hold 6 to 8 seconds. So that's point 1. And point 2, it's on the back of the neck, and we're going to locate in the manual. It shows a little diamond. We call that the big bone. It's this. It'll pop out if you put your head forward. It's the big bone is at the base of the neck. We want to be 1 to 1.5 inches to the left of the big bone. And with the first 2 fingers, we're going to hold point 2, 6 to 8 seconds. Very lightly. And that's the greeting. And now you can address anything else that you want to do. So I think it's okay. Thank you.
So make sure can you see me in there doing that? Yeah.
Yes.
Okay. So what we've done is we put these in order of importance. So all you do was the greeting, that starts a healing process. Then if all you have time is just to do the next thing, so we've tried to put those in order. They're not the same order in the manual. So the headset would be the most important thing to do, okay, which works on the whole pituitary center, the whole master gland that runs the whole show. So especially when there's irritability, tiredness, depression, anxiety, anything that has to do with our emotional well-being or mental well-being, the headset appears to address that, okay? So we're going to start with step 1. Step 1 is 2 points, A and A. So you're looking for those A's. Now, just so you remember, all the words that we tell you here are also described perfectly in the manual there. So we who train people how to do it, we're just using the words right out of the book. And also when you look at the video or the DVD, the words, they show somebody doing the points, and they're actually telling you where the points are at the same time. So there's all kinds of different ways that you don't have to remember everything here because it's all perfectly written there. So don't just look at pictures. Like when you do your internship, one of the things is going to learn where the points are, because the pictures, they don't really give you a good idea, but if you read the words, it takes you right to the point. So the first points, A and A, point A in the front is just on this little ridge line here where the crown meets the side of the head or the forehead on this point. So that's point A in the front. And point A in the back is right at the base of the skull in the middle of the neck. Okay, so that's A and A. Okay, now step 1. Okay, what we want to do is we want to find an X. If you'll notice, X is always usually the hold point, which means that point's going to stay stationary. And on this particular situation, you want the X to be at the base of the skull on the side of the large muscle. And you can pick either side because we're going to touch the opposite side called a crossfire. Okay, so I'm going to at the base of the skull on the side of that large muscle. And then I'm going to the opposite side of the body. This is working pretty good. Can you see it?
Yes.
Okay. Point 1 we're going to be on this ridge line for points 1, 2, and 3. The side of the head and the crown has a ridge. You can feel it on yourself. Point 1 is going to be straight up from the corner of the eye on that ridge. Point 2 is going to be straight up from the front of the ear on the ridge. Point 3 is going to be straight up from the back of the ear on that ridge. And now you're coming about a third of the way down the ear and an inch or two back, and you're in an indentation. You should be right straight back from the corner of the eye, or again, if you start at the base of the skull, you come up over a ridge and you fall right into it. So we'll be practicing that. You'll be able to. And then point 5 is at the base of the skull side of the muscles, same with where your hold point's at. And then you're going to swap and do the other side. Point 1, straight up from the corner of the eye. Point 2, straight up from the front of the ear. And all the points are 6 to 8 seconds. And like a butterfly. Point 3 is straight up from the back of the ear on that ridge. Point 4, you're coming down about a third of the way down the ear and an inch or two back in that indentation. And then point 5, did I say 4? Yeah, 4, 5. Now, the interesting thing to keep learning is there's really few sets of points. We just do them different ways, right? So now we're going to do what we call matching fire. We're going to do 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. And then you're going to take, this is one of the only times we use our whole hand, you're going to take the open palms and you're going to place them covering points 1, 2, and 3 without touching your hands together. It's interesting, as I'm looking at her, I'm thinking about these robots they're making now. And pretty soon we'll have our own little robot that'll move itself and we don't have to do anything. That's the headset. Any questions? Really simple, incredibly effective and powerful little set of points. So, okay, let's do the next set. What is the next one? Am I doing this too? Okay. Okay.
You're okay?
Look.
You're the tall one.
Yeah. Okay.
Hey, when did you get that? Sorry.
Where did I get what?
The sand.
At the Mesquite Road. Metabolism. So here's the other part of it, right? You can see we're working all the thyroid. That'll be the first set. We're working around the middle of the back, the adrenals, the kidneys, all those things that have to deal with the hormonal system. Okay, so two-part to this set. First step is right in front of this large muscle of our neck. Okay, and points 1 and 1 are just going to be just above the collarbone, in front of that large muscle, just to either side of the notch of the top of the breastbone there. And then we're just going to follow that muscle up. So we're going to go halfway up the neck in front of those large muscles. And then the top of the neck in front of the large muscles. Now you can do it once, twice. I mean, repetitive is okay too. And again, 6 to 8 slightly like a butterfly. Step 2, now we're looking for the hold point. Okay? It's on the left breast. And it's described 2 ways. It's at a level where the nipples would be on a U. So picture it, if you can. It's been too long.
That's true. This is
Well, here, let me show you.
Please show.
Or you can start at the bottom of the breastbone, and if you come about a third of the way up and then over an inch to an inch and a half, that's where it is. It usually sits right where the cut of the bra is or the bathing suit. So that's it. That's your hold point. We're going to hold there only on the left. Okay, well, we're going to do those points 1 through 4 on the back. Okay? Whoa. Shoulder dislocation. Okay, we're going to undo this. So we're holding in the front. And we're looking for this middle point. You see that dotted line on the chart there? That little dotted line that goes around in the middle of the back there? Okay, that is showing the bottom of the ribs. The last rib, the T12. And where it comes into the spine. It's also easy to find that that's going to be our reference point. If you go straight through from that greeting point 1, if you go straight through, you're going to be right at that, what we call the breakover point. So points 1 through 4 are in reference to that breakover point. So we're holding in the front, and we're going from that breakover, we're going 1 to 2 inches above that on the left spine muscle. Point 2 is directly across from that on the right spine muscle. No.
Yeah.
So this was the left spine muscle, right spine muscle. Now, usually points don't matter where they are. The only reason we're doing it specifically here is because point 4 is a very specific side. Point 3 is 2 to 3 inches below the breakover on the right spine muscle. And in this situation, we would probably add point 4, which addresses blood sugar. And I'm sure blood sugar gets wacky during menopause. So we're going to do point 4 also, which specifically addresses blood sugar. And again, you could do those. And an easy way to figure this out too is you want to stay below the shoulder blades and above the hips. So there's basically 4 points. And again, you could just repeatedly do those too. So if you've done the front twice, you could do this twice. So you see how we're working all around the adrenals and the kidneys, the thyroid. We've worked around the pituitary center, all the central glands. So those are important. And then what's the next set that we have?
Lower abdomen.
Yeah, so now we're dealing with the hormonal system in the lower abdomen area, okay? So what we're looking for here, so on this one, people will probably be laying on their back. That's the easiest way to do it. And what we're looking for is we're going to stay inside the hip bones, above the pubic bone, and below the navel. That whole area there, the whole lower abdomen area where all the hormonal uterus and the ovaries and, you know. So even, and we've been talking to Paula, you know, getting her ready if she does do a hysterectomy. And I have worked on a couple of women who've had a hysterectomy. The healing time was half the time. I mean, they told them whatever it was, 8 weeks or 12 weeks, they were getting around in half that time and actually got working with them right out of the anesthesia. So they bounced right out of it quickly. So this is really good even pre-post operations too. So this is a 4-step process. What we're looking for is the whole point here also, and that's just at the top of the pubic bone. Okay, and that's lightly. Now, as it says there, these points are done with firmness. We've never really figured out why that is, but it's interesting. If you don't do it, people say, oh, you can touch a little harder there. It's just something natural about touching firmer here. And it's not about touching through so you hit their spine. It's just a little bit of indentation. Usually there's no indentation at all. So, but not on the whole point on the X. Point 1, just below the navel. Okay? Points 2 and 3 are going to be low on the abdomen just inside the pelvic bone. That's 2, 3. Now I might not be the right side because sides don't matter. The order doesn't matter, just that you get all the points. They're there to give you a way to teach it, but I might be wrong compared to what the book's showing you there. Then, so that's 2 and 3, and then 4 and 5 are just inside the top of the hip bones. Again, I'd be pressing pressure, but she's not giving at all. Okay, so I've done 5 points. And now, because they're on their back, you're going to slide your open palm underneath, and those 2 fingers are going to rest at the sacrum, that flat area in the low part of the spine. I learned about the sacrum today in my yoga class. It's the centerpiece of the whole body. Everything bases around the sacrum, which is interesting when we do the back set. So anyhow, we're on the sacrum, and we do all those points again. So we do 1, 2, 3. Is this visible there even? Yeah. 4, 5, and the X2.
1 and 2 are not showing. The one.
Oh,
Camera's 2 of them.
you can sort of twist it down a little if you can, just real easily. Okay, now this is also a good time that we talk about local working enhancements, where you can do little local sweeps. You can come over the ovaries, you can come down, come across, all those different little, and we'll practice that in the room. And then we bring our hand out and we do those points again, this time in a matching fire. 1 and 2, 1 and X, 2 and 3, and 4 and 5. Any questions with that one? No? Okay. So, we have given you the basic set of points. We hope you've learned them online there. Go to justtouch.com and get the manual if you want. So what we're going to do here is we're going to actually go into the rooms and we're going to practice. And we'll see all of you next month. Next month is what is it? And jaw problems. So thank you all for coming on to Facebook, and thank you all for joining. And let me turn this off, and then we'll break up into groups.